Okay, I'm going to introduce you, but everyone, welcome to our MEC, our second day. This session is going to be Professionalism in Medicine with the amazing Dr. Latonya Washington. So I'm going to tell you about her. Dr. Latonya B. Washington is the president of the Bluff City Medical Society, the premier organization for physicians of color in the Memphis metropolitan area, and a subsidiary of the National Medical Association. Dr. Washington is board certified in internal medicine and pediatrics and is currently the physician advisor at St. Francis Hospital, Memphis. She maintains active clinical hospital privileges at St. Francis Hospital and Methodist Le Bonheur Healthcare. She received a Bachelor of Science from Tougaloo College and a Doctorate of Medicine at the University of Tennessee Health Science Center in Memphis, Tennessee. She completed a combined internal medicine and pediatrics residency at University of Arkansas for medicine, medical sciences, and obtained a Master of Business Administration at Auburn University. Dr. Washington is passionate about bringing awareness to social injustices, identifying and improving health inequities through improving health literacy and health care access, and the need to increase diversity in healthcare by increasing the number of underrepresented minorities in medicine. Dr. Washington is committed to educating the community on health-related topics, most notably COVID-19, a topic of which she has spoken on numerous occasions since the start of the pandemic, spearheading the Washington and Memphis area Tougaloo Alumni COVID-19 Town Hall Series, and serving as a medical media correspondent for the Memphis and Shelby County Joint COVID-19 Task Force, just to name a few. Dr. Washington's personal mission is to improve the health and well-being of those around her through education, empowerment, and action. Thank you so much, Dr. Washington, for being here, and kick it off.
Thanks, Elizabeth. I appreciate those kind words. So today, I think it's important that we talk about professionalism in medicine. One of the things to recognize is that this might be the only talk that you guys get on professionalism in medicine in your entire careers. Sometimes it's not really in the curriculum. It's something that we are told we should be. We should be professionals, but no one really tells us how to be professionals. So that's why I thought this topic was so pertinent. I actually was in a professionalism in medicine talk when I was in residency. So probably about 15 years ago now, where they talked about this very topic, and I had never heard it before, but we also hear about students, residents, and practicing physicians that have issues with professionalism. So that's why I thought this topic was important today. So let's start with a definition. So professionalism, the conduct, behavior, and attitude of someone in a work or business environment. Professionalism leads to workplace success, a strong professional reputation, and a high level of work ethic and excellence. So that's a pretty all-encompassing definition of professionalism. It really goes beyond medicine. It could be any career. But when we read this definition, we also see that professionalism is something that's very subjective. So how do we develop professionalism? We really want to be able to do it in a step-by-step manner. So I have next a list of 12 ways to develop and practice professionalism. We can really drill down into these 12 steps. There are a couple of things, and I'll talk about some of the things that I do to try to become more professional and to really reach my highest potential. So number one, be productive. So that's easy. You know, when we talk about studying, I know one of the things that really hinder me when I'm studying, you know, you may have your phone, you might get sucked into social media, YouTube videos, what have you. I have this issue also during my workday. So what do I do to become more productive? I put my phone away, I put it in my pocket, or I don't access my screen. We talked in one of the other sessions on yesterday about one of the young ladies was asking about an Apple Watch. I do use that. That keeps me from looking at my phone. That way I know if my phone is ringing for a work-related call or if I get a text message, I can just peek at my watch and I don't necessarily have to pick up my phone, because sometimes that can be my downfall. Number two, develop a professional image. Well, what is that? We're physicians, so we want to look the part, whether that is, wearing scrubs, or whether that is, wearing a crisp white coat, but looking the part. So I always learn, dress for the position that you want to have. The next one is taking the initiative. So for you guys as students, residents, prospective students, taking the initiative means to act interested in what you're doing. Make sure that the people around you know that you really want to be there. You want to learn as much as you can. And then maintaining effective work habits, whether that is making sure that the job gets done, that rolls into managing your time wisely, um, and also demonstrating integrity. I have done a lot of interviews for the medical school this year, and one of the questions that they tend to ask is about honesty in physicians. And really, honesty is a way that we demonstrate our integrity. So, as physicians, our integrity is really the only thing that we have: integrity and reputation. If that becomes tarnished, then we really have a rough time rebuilding those things. Next is providing a quality work product. So for you guys as students, that quality work product means, your progress note. That means if you're attending, a resident asks you to do a presentation on a topic, that you have that down pat. You are able to give all of the information, you're able to answer the questions appropriately. So providing that quality work product, so that when they say, oh, I asked, this medical student to do this, and this is what they did, this is what they came back with. The next thing is be a problem solver. So I see this really in my current role as physician advisor at St. Francis Hospital. We have people that come all the time and they talk about what issues they're having. And it's always easier if that person comes to you and say, hey, Dr. Washington, I see this as a problem, but I think if we do this, that we can solve it. Like, don't just bring a problem and drop it off. Actually have some ideas as far as what you can do to help remedy the problem. The next is be resilient. Really in healthcare, we get a lot of constructive feedback. Sometimes it's not always positive. And so it's important not to wear your feelings on your sleeve. Understand that even though that feedback may not be delivered in a way that you wanted it to be delivered, that it still has some benefit. Someone may tell me, well, Dr. Washington, I think you have a bad attitude, and I don't like the way that that was delivered. But when I sit back and I reflect on that, then I probably do need to make an attitude adjustment, even though I didn't like the way that person told me that I needed to make an attitude adjustment. And so sometimes that also involves having your circle of friends and say, hey, do you think my attitude is bad? Because sometimes you can receive that feedback from someone in your circle as opposed to someone outside of your circle. And then learning to communicate effectively. That's very important, whether it is verbal communication or written communication. And then also developing self-awareness, so that we can kind of circle back to that being resilient piece. If someone gives me some feedback that I don't necessarily like, then I need to take the time to reflect on those things. And I need to sit down and say, okay, how can I be different? Or how can I make modifications so that the way I deliver information is not so harsh? And then finally, building relationships. Professionalism is a lot about networking. And so that really involves meeting people who are doing what you want to do, meeting people who are doing things that are similar to the things that you're doing. So when we talk about professionalism, specifically in medicine, professionalism is the basis of medicine. So it's more than doing a particular type of job, but more about being a particular type of person. So when we talk about professionalism in the practice of medicine, we all took some form of the Hippocratic Oath when we were coming into school. Well, as far back as 1990, the American Board of Internal Medicine began a project professionalism. They saw that it was important that as physicians that we were able to exemplify a certain level of professionalism. And then they went on in 1999 to charter the medical professionalism by the ABIM Foundation. So when we talk about professionalism being the basis of medicine, that is basically medicine's contract with society. And so what does that mean? That means, number one, the patient's interests are above the interests of the physician. It means that we set and we maintain standards of competency and integrity. And it also means that we provide expert advice to society on health matters. Really, when I went back and I read through this definition, I thought about how it really was so pertinent today, particularly the providing expert advice to society on health matters, because it really seems like there's an attack on that is happening right now. And so when we talk about medical professionalism, there are several key themes. Number one, altruism, as I spoke before, the interest of the patient is always at the top. It's not our self-interest. And so when we see that, I can certainly speak about my medical career. There were often times when I missed several things that I wanted to do, family gatherings, weddings, funerals, all of those things, because I had to be present for my patients. The next is accountability. We are accountable to so many different levels. We're accountable to the patients, the patient that is in front of us. We're accountable to society to be able to provide pertinent medical information. And then we're accountable to our colleagues and to the medical profession overall. We are expected to have a level of excellence. We are expected to exceed expectations. And so when I saw that saying exceeding expectations, that is important, but I think also is very important that we manage expectations. We have patients that come in and, they may have very severe medical conditions. So it's important that when they walk in the door that we manage those expectations and say, hey, you have all of these medical conditions. I may not be able to fix them all, but I'm going to get you at the best self that I can possibly get you to. And then when we talk about duty, it is our duty. So we have to have a commitment to service. I tell everyone who's interested in medical school or any type of medical profession that it's important that they do some type of community service so that they can see if they really enjoy serving others, because that's what we do every day. And that we lend our expertise for the welfare of the community. And then honor and integrity. Everyone really should have a personal code of honor or personal code of integrity, but then we also have professional codes also. And we should always seek to meet those standards. And then respect. Respect is the essence of humanism. It's important that we respect our patients, we respect our colleagues, and that we respect other members of the society. And so kind of diving down a little bit more deeply into the Charter on Medical Professionalism, this slide is a little bit busy. But again, they talk about three key things: patient welfare. Patient care should not be dictated by outside forces. So basically that means that as a physician, I should put the patient first. It is, when we're talking about patient welfare, it is not important what I have going on as a physician, other things that are going on. If I had a bad day, if I had a bad night, those things are unimportant. What is important is the patient that is in front of me and that I do the best by that patient. The next thing, patient autonomy. It's important that we're always honest with the patient. You guys may have certain scenarios that you will be placed in where patient family members may request, they may say, hey, I don't want you to tell them about this diagnosis. I don't think that they will handle it well. Well, it is our duty as physicians. The patient is it. It is our patient, that patient, not necessarily what the family request. And so, if that patient does have the ability to make sound decisions, that patient does have ability to process and understand what's going on, then it is our duty to remain honest with that patient and also educate them so that they can make informed and empowered decisions. And then the social justice piece, which is very interesting because this ABIM Charter on Medical Professionalism was written in 1999, so well over 20 years ago. But social justice, meaning that the promotion of justice in health delivery and the distribution of resources is of utmost importance. You know, these are things that we're still dealing with today. Right now, as we're in this COVID pandemic, we're talking about the distribution of resources, vaccines, all of those things. So we're still really fighting to make sure that we're seeing the equal distribution of healthcare delivery services and resources. And then we also talk about professional responsibilities, like what are things that we have to do personally to make sure that we are maintaining that level of professionalism. A lot of these things we've talked about already during this talk, but number one, professional competency. So that's our board certifications, making sure we're able to maintain those, making sure we have that lifelong learning where we're always striving to learn new things, to stay abreast of the changes in healthcare, that we're honest with our patients, that we maintain patient confidentiality, that we maintain appropriate patient relations. You guys would be surprised at the number of physicians and healthcare professionals that have inappropriate interactions with patients, whether it's a sexual relationship with patients, which is always out of line, whether it's getting like additional money or accepting gifts or anything like that. Like all of those things are inappropriate. We have to improve quality care and improve access to care. Back again to the just distribution of resources. Um, Number 8 is commitment to science, making sure that we are promoting sound science, that we manage conflicts of interest. You guys are early in your medical career, but when I was in medical school and in residency, big pharma was a big thing. You know, we had drug reps coming in all of the time, bringing us dinners and inviting us to different events. Well, you can imagine that sometimes that does influence your prescribing. You know, if this drug rep that had this particular medication bought me tickets to the Grizzlies game, then I'd be more likely to prescribe those medications. And so, you know, they understood that this is a conflict of interest. And so they really outlawed that. And they enacted things like the Physician Sunshine Act, where when we accept meals and any type of small gifts, that is public information. And then also having a commitment to your own professional responsibilities. And so, what are the challenges to professionalism? So now we're getting down into the nitty gritty. You know, number one, abuse of power. Understand that when we are in these professional situations, people who are in positions of power certainly have the ability to abuse it. So when we talk about sexual harassment, if an attending is making a subordinate to feel uncomfortable with sexual advances, whether that is making others just feel uncomfortable, making them feel belittled by the way that they speak to them. You know, again, way back when I was in medical school residency, it was fairly routine that we were made to feel very, very, very small if we didn't answer these questions correctly. And that could be considered an abuse of power. And really, it could be considered unprofessional at this point. So then other challenges include misrepresentation or fraud. Are you not lying to patients, not telling them the truth? Are you attempting to extort patients for money? Are you doing other things like doing procedures that the patients don't require for the financial gain? Another thing, a big thing I think in healthcare is arrogance. You know, thinking that you know everything and that, the questions of your patients or the questions of your subordinates are insignificant. That can also be a challenge. Greed, we talked a bit about before. Why are you attempting to attain all of these things? Are you doing more procedures on patients so you can make more money? That's always inappropriate. Are you seeking this higher position so that you can have more power within your organization? All of those things are very important. And then impairment. So physician impairment or impairment of anyone really is always something that we need to discuss, whether that is drug or alcohol abuse or some type of mental impairment that could affect the way that we deliver care for patients. All of those things are very important, and it's important that we talk about how we address those in a professional setting, because often as colleagues, we're the ones that are able to see that our colleagues are impaired. And then bias and racism, that's a challenge to professionalism as well. So we will talk about this a bit more. I have a couple of examples that are in some future slides where we'll talk more about that. And then lack of conscientiousness. That includes laziness. So are you doing everything that you really should be doing? Are you collecting the bare minimum on your history taking? Are you doing the bare minimum on your physical exam where you would miss something that could potentially affect the patient outcome? Are you late and you cause your team to have to wait on you? All of those things are a challenge to professionalism. And then again, back to the conflicts of interest, again, a challenge. And so what's our responsibility personally? Our main responsibility is we should treat everyone, the golden rule, treat people how you want to be treated. So number one, how do we treat each other? So how do we treat our students? How do we treat our residents and fellows? And how do we treat our patients? Again, I always kind of go back to the golden rule. I'm always really trying to think about how I can modify the way that I deliver information or the way that I treat people. I always say that any patient that I treat, I'm going to treat them the way that I would want someone to treat my parents or someone that I loved. So now we'll transition over into some examples, and then I'll open it up so you guys can certainly chime in on these because it'll be a question at the end. So here's an example of a college student. So JM is a college senior with aspirations of attending medical school. She was placed in a research lab for a summer program prior to her senior year, but didn't like her supervisor, so she didn't return after the first week. However, JM listed this research experience on her AMCAS application for medical school. Would this be considered professional or unprofessional behavior?
Unprofessional.
Right. So it's unprofessional, but it certainly could also affect JM going forward because the medical community is relatively small. And that's one thing that a lot of people don't realize. And so what if the place where JM was applying to medical school, what if the person that was interviewing her knew this researcher that she was interviewing with and picked up the phone and called them? And they say, well, I didn't even see her after week 1. So, or what if they ask her detailed information about this research experience and she's unable to talk about it? So that can really affect her in the long term. So we'll move on to the next one. Next example is a medical student. So DJ is a fourth-year medical student with plans for general surgery residency after medical school graduation. DJ's best friend is getting married in Miami in 3 months, but DJ is on his surgery acting intern rotation. He really wants to go to the wedding, so he tells his clerkship director that he has an interview during the weekend of the wedding so he can go. So is this professional or unprofessional behavior? Kind of no brainer, right? Right, no brainer. It's unprofessional. So these scenarios sound kind of outlandish, but I actually know that this has happened to someone, and as a result, they had to undergo disciplinary action. And so it's important that we are honest. Again, the medical community is small, so this person, lied about going to a residency interview, and surgeons know each other. What if they pick up the phone and say, "Hey, are you guys having interviews this week?" No. And then what if DJ posted pictures on his social media of him living it up in Miami at his friend's wedding? That's not very smart. So next, interviewee. So KP is interviewing for a residency position at UTHSC. He opted out of getting a haircut and decided not to wear a suit for his interview because, this year everything's virtual. He also decided to keep in his tongue ring and nose piercing. And when they asked what he knew about Memphis and about UTHSC, he said he'd only heard about Dr. Death. What about KP's actions were unprofessional?
I would say not wearing a suit, and I mean, without any context, just kind of like bringing up Dr. Death, because that's not a particularly positive thing to say regarding UT.
Absolutely.
And the piercings as well, the tongue ring.
Yeah, so this one, I kind of put several things in this particular example. So looking the part, it's important to look the part. So, okay, if you are a man and you decide to wear your hair long, that's fine, as long as it's kind of in a neat fashion. So a haircut is plus or minus. Deciding not to wear a suit, we know that for medical school interviews, for residency interviews, suits are the standard. So you certainly want to to meet that standard by wearing a suit. Piercings, recognize that most of the people you're going to be interviewing with are of an older generation, and piercings really haven't become mainstream. And so if you have a tongue ring, I know some people don't want to remove it, but if you have the one that kind of looks flesh colored, the nose piercing, I would recommend, that you remove that, or at least kind of change it to one that is less noticeable. And then just bringing up things that aren't positive about the place that you're interviewing at is never a really good idea. And so for those who are not from Memphis, if you're here in this room and listening about Dr. Death, then I'll just say Google it to learn more about that situation. All right, here we have another example. So Dr. S is an internal medicine attending. He attends on wards about 3 times per year. He prefers all female residents and medical students on his team, and has asked that they all be pretty. The female residents and medical students have complained that Dr. S makes them feel uncomfortable with his remarks. What is problematic about the activities of Dr. S, and how should they be addressed?
Well, it seems like he is kind of abusing his position of power to kind of target young women. But I mean, it seems like the medical students who have been victims by him have complained, so I'm assuming they've reported it. But whoever is like a colleague of Dr. S, someone at his level should hold him accountable.
Exactly. So, and we'll talk about this a little bit more later on as well. So, we have the students and the residents who have complained, and we would assume that they've used the appropriate channels to complain. If nothing has changed about Dr. S's actions, then it is important that one of his colleagues or his superior kind of holds him accountable for these actions. And this can really be problematic. You know, sexual harassment lawsuits and all of these types of things are very damaging to colleges and universities. So it's definitely something that the university should know about. And usually through your university handbook, you will find information about how to make a complaint or to make a report. And again, we'll talk about that a little bit in the future. Okay, here we have another example of physician-patient interaction. Dr. A has admitted a 50-year-old Black patient for diabetes, elevated blood sugar, and diabetic ketoacidosis. The patient has a hemoglobin A1C of 13. The patient is uninsured and discloses that she doesn't have the money to pay for her insulin. So she stays in the hospital for 4 days, and then she's discharged home with a prescription for long-acting insulin. So what are some of the things that Dr. A can do to ensure the best possible care for this patient?
Dr. A could look for resources in the community to provide to the patient, and hopefully like be able to get them like care after the insulin runs out.
Mm-hmm. So a couple of things with this particular case. So we have this patient with diabetes and with elevated blood sugar. And so a hemoglobin A1C of 13 is not good. We really would like for that number to be around 6.5, ideally. So she's very far off, which tells us that her diabetes hasn't been under control for some time. And so understand that insulin can be expensive. So the long-acting insulins are the ones that are particularly expensive. So when we talk about the insulin glargine or the Lantus, that medication can cost upwards of over $100 per month if patients don't have insurance. So one of the things that Dr. A could do is look into lower cost options for insulin. And although the patient may have to take it more frequently, it's important that we make sure that the patient is able to get this hemoglobin A1C under control so that they don't have any of the long-term adverse effects of diabetes. There are also other things that Dr. A can do, like trying to see if we can get the patient plugged in with community health centers that see patients who are uninsured or underinsured. A lot of those facilities tend to have pharmacies on site. They have medication assistance programs that can help patients to obtain their medication so that they can really stay on track with their treatment regimen. All of those things are extremely important. We see a lot of patients who are uninsured or underinsured. And so one of the things that I would encourage you all is to always think about that, ask the question, because patients aren't really going to volunteer that information. If they can't afford their medications, that's a source of shame for a lot of patients. So they don't want to talk about that. So you really have to ask and say, or ask, how much does your insurance normally pay for your medications, or how much do you have to pay for them normally? That's one of the things that we can do to kind of break that barrier and do it in a way that's non-judgmental. One of the things that I tend to do is I'll say, how much does it cost for your medications? Because I know I don't like spending a lot of money on medicines. So in our next example, JC is a 70-year-old woman that was hospitalized for pneumonia. She's on the teaching service and is being cared for by the intern. Dr. O, the intern, mistakenly entered an order for Lapse instead of Levaquin and didn't realize until the patient had already received the medication. So for context, Lapse is a medicine that is used for intestinal spasms, and Levaquin is the antibiotic levofloxacin. So the patient received the medication, the incorrect medication. And so is it important that Dr. O tell Miss JC about this mistake, even though no harm was caused? What do you guys think about that one?
I would say yes. I think it's important, as you've mentioned in the talk, to be honest with your patients. You know, we do make mistakes, and I think it's also fair to be able to, you know, communicate that to the patient and say, I made a mistake, but I'm also working to fix that, and, you know, apologize and that kind of thing.
Absolutely. And so in my opinion, that's one of the things we don't do very well in medicine. We don't always admit our mistakes and whether harm was caused to the patient or not. You know, a lot of times when lawsuits are brought against physicians and healthcare systems, you know, the patients will often say that no one even told me that this was a mistake that was made. Sometimes when mistakes are made and and there is an apology for it, those tend to not even go on into lawsuits. You know, the patients want to feel like somebody cares about what happened, even though things didn't go well. So we have another one here. So this is a physician-physician interaction. Dr. B is an anesthesiologist and is assigned to the OR with Dr. Y today. Dr. Y notices that Dr. B's speech is slurred before the case. He also notices that Dr. B fell asleep during his surgical case and that he appeared more disheveled this morning. When Dr. Y asked Dr. B if he was okay, he stated he had a rough night. What should Dr. Y do about this?
He should definitely report Dr. B. Yeah, I was just going to say this happened in the Dr. Death podcast, but yeah, he should definitely be reported, and
Right.
some disciplinary action or counseling should occur for the anesthesiologist.
Absolutely. So, you know, we're talking here about the impaired physician, and really, as a colleague, you have a duty to report because you're protecting patients. You know, if the anesthesiologist falls asleep during your surgical case, then that's not good. Who's monitoring the patient during that time while you're operating? So, when we talk about the impaired physician, again, most institutions have a set way that you should go about reporting that, but then you can also report it up through the various departmental chairs. A lot of times, the physician services offices at various hospitals will have a way to anonymously report who you feel is an impaired physician, and they have to investigate those claims without any evidence of without you having to be subjected to any type of retaliation, because you're doing this in a way where you are trying to attempt to keep your community and keep your patients safe. All right, this is a student-professor interaction. So there are 10 students of color in the second year class. During one of the basic science lectures, one of the OBGYNs commented that Black patients tend to be more promiscuous, have more STDs, have more teen pregnancies, and more abortions. The students feel that this is perpetuating racial stereotypes and attempt to discuss this with the professor, but they are ignored. What should the next steps be in this situation?
Report this to the course director or talk to a dean regarding this, and explain why this particular comment from the professor is problematic.
Absolutely. You know, one of the things that I will say, particularly for the student professor or the student attending scenario, is that, you know, there's definitely strength in numbers. So having a group effort to report these situations is always positive. And then having a written account of what happened is also important. And so having those numbers and saying, you know, everyone really was made to feel uncomfortable about this. And I agree, the first step is to talk with the course director. And then if there are no changes that occur, then the next step would be to progress to the dean. Because it's really important that when we are dealing with medical situations that we don't perpetuate racial stereotypes. I mean, we have to understand that in these learning environments, you know, that is part of some of the issues with healthcare and with the racial stereotypes that have been perpetuated throughout the years. We really have to work to modify those types of thought processes. And so I do have a few extra slides in here talking about, particularly about medical students and how to remediate lapses in professionalism in that particular group. However, I will say that this information that I'm talking about really can be extrapolated to all levels of medical professionals. But there have been some published papers about medical school remediation for lapses in professionalism. So in this one paper, they talked about several medical schools. I believe that there were about 100 medical schools that were evaluated, and they talked to them about what their process was for professionalism lapses. So 82.2% of those schools required a mental health evaluation for those individuals. 73% of the schools required some type of remediation assignment, whether it was watching some type of online course or doing some additional modules to make sure that they understood what the issue was with their specific lapse. And then the 73.3% also required some type of professionalism mentoring. That's one of the things that I think is key, because really when we talk about professionalism, it's really modeling the behavior that we've seen in the past. So we often mimic what we see in our particular settings. So strengths were that a lot of these schools were able to catch these minor offenses early. They really emphasized professionalism on a campus-wide basis, and they focused on helping the students rather than punishing them. Now, the weakness was that there was a reluctance to report by student and faculty. I think we see this throughout, and that's one of the challenges that we have to professionalism in the medical community. The next weakness is that there's a lack of faculty training. So we say, how do we identify someone who has unprofessional behavior? Again, we talked early on about how it was rather subjective. And then that the policies were somewhat unclear, or that the remediation tools were ineffective. And so when we talk about unprofessional behavior, one of the articles that I read, and I will, once I finish talking, I will drop this into the chat. There was an article that talked about Victor Hugo, who wrote Les Mis, and it says, what is argot properly speaking? Argot is the language of misery. So when we say argot is a specialized vocabulary for people who are in the same type of work. So those are things that we say as physicians and healthcare professionals that if someone outside were listening to us, they wouldn't necessarily know what we were talking about. You know, so I know that I've been guilty of this, and in preparing for this talk and it was really like a period of reflection, like, oh, I probably don't need to say that anymore. So those are things where we talk about, patients are frequent flyers, meaning they come to the hospital a lot. Other things that are derogatory, which I don't do, is, like calling people morbidly obese patients, saying, oh, they're like a beach whale, or patients who are in a vegetative state, calling them vegetables. I think we've seen this throughout time. There's also been a push to get away from calling patients who have sickle cell disease sicklers and things like that. We will say, that is a patient with sickle cell disease. We wouldn't call them sicklers, because we recognize that that's inappropriate. And so basically it's saying that when we have these types of things, when we have this type of talk, that really can sometimes be a sign of burnout. Saying if we're referring to patients in a negative or a derogatory tone, then we really need to step back and look at what we're doing and saying, hey, is there something that we can do differently? Maybe we need to take a few days off if possible. Maybe we need to de-stress in some type of way, because it's not important that it's very important that we don't refer to patients using such negative terms. And so this slide, it may be a little bit small for you guys to see, but so the 4 I's of unprofessional behavior, this as in medical students, but really it's across the board. This could be used for anyone. So when we talk about unprofessional behavior, take a look at these things. All of these are important. Involvement. Are you late or absent? Are you not meeting deadlines? Do you have poor initiative? You're disorganized. You're cutting corners. You're not a team player. You're having difficulties with language, meaning not communicating effectively. Integrity. Remember, I said this was one of the key things. Are you cheating on exams, plagiarizing, data falsification, meaning, you didn't complete the history, but you made up some stuff to put in your history taking, or doing something without the patient's consent. Interaction. Are you communicating effectively? Again, a lot goes back to communication. Inappropriate clothing. Inappropriate use of social media. That is a key one. A lot of people get caught up in that because they post too much information on social media. Are they being disruptive, violating confidentiality, bullying, discrimination, sexual harassment? That's a huge one. And then the 4th I, the introspection, that's one that's very personal. So number 1, are you avoiding feedback? That's when I said, it's important that we be able to receive feedback, even though it wasn't necessarily in a way that we would have liked to receive it. And then kind of blaming external factors instead of saying, okay, maybe I didn't do that right. I need to look at myself and make a decision or make some changes on what my actions were. And then not being aware of limitations, that's something that's key. In healthcare, we cannot do everything. We don't know everything. So it's important that you recognize that, hey, that is outside of my lane and I shouldn't do that. And a lot of times, if we are unaware of those things, you can see how all of these things can cause harm to patients, which we don't want to do. And then when we look at the profiles of unprofessional behavior, when we're looking at those 4 I's that were on the previous slide, you can imagine how someone would fall on this particular scale. We really want the individual to be at a point of high reflectiveness and high adaptability. That's when we're more able to make modifications and help them to come to a place where they are in a more professional light. And then when we talk about this roadmap for responding to professional lapses, this one is a little bit small, so I apologize for that. And I have to even look over at my second screen so I can see it because, I'm kind of old. So when we look at the top, so phase 1 is that the student has an accidental lapse in professionalism. That's when we do the exploration and understanding, and that we teach and we utilize the regular curriculum. So then if they continue to have these actions, then we move into phase 2. So that difficulties acting professionally, needing support, and personal remedial teaching. And so that's the remediation phase. And so that's important that we follow those students very closely. And then on to phase 3. That means that, so you've done phase 2, you've had that additional coaching, you've gone into phase 2, you had the remediation, and then there's still issues. So repetitive professional lapses despite the teaching. And so then that's when you start to gather that information. You have strict monitoring, and then that student may be considered for dismissal. And understand that, when we are looking at dismissal on the grounds of unprofessional behavior, that really is something that is regulated by the governing body. And so then I'll get to the closing. So the take home points. Professionalism in students and trainees, it's often subjective. It really can impact your ability to graduate or move to the next step in their educational process. It's important that you make every effort to correct issues early, that you are able to request and accept feedback and make those needed modifications, and to always keep a paper trail. So one of the things I tell students, if you get verbal feedback or a verbal criticism, if you will, just to follow that up with an email reciting the key theme and asking, is there anything for you to do, anything that you can do to rectify the situation? That's very important. And when they give you that feedback and say, these are things you can do, then actually do those things and then follow up again. And so professionalism in attendings is, understand that as a student, and you are talking about professionalism in your attendings, they are the ones that are in the position of power. There should be a way that you can do reporting anonymously through your institution. And those reports should be made at an institutional level prior to advancing up. But understand that even the university has someone that they have to answer to. I know that ACGME has a program, and you have the ability to file complaints there too, but it's important that you go through the proper channels. And then make sure that you keep documentation for everything. And so I'll stop here. Do you guys have any questions? I'll stop my screen sharing, and then, yeah.
I have a question.
Yes.
So you kind of alluded to how professionalism is often based on kind of mimicking behavior. And I kind of was thinking about, it's kind of in some ways easy to think that it's upholding status quo. And I've also noticed that professionalism is often used as a kind of a tool for some people in power to shirk responsibility for change. And it almost seems like professionalism and activism are at odds at some time. So I'm kind of curious if you could just speak to that kind of tension, I suppose.
Yeah, absolutely. I definitely agree. A lot of time I feel like medicine is somewhat resistant to change in a lot of ways. And so when we talk about that, it's important that you kind of garner support from those around you. There are a lot of younger physicians who are in practice that you can reach out to that will really hold some of the similar beliefs. I certainly am one. I feel like a lot of things in medicine should change, particularly when it is involving healthcare delivery, becoming more efficient, how we treat students and residents, all of those things. And so over time, my belief is that we will get to a more cohesive ability to be able to share experiences, and that your learning experience as a student or as a resident will become more positive. Again, like I said, I came through residency during the time. I'll just give you guys this quick story. So I did residency during a time where our department dean or our department chair would say, he would do morning report with us every morning. And he would ask us all of these questions. And for the ladies, if we didn't get the question right, he'd say, oh, well, you have your white coat already. You can just cover up your name badge and you can just go down to Dillard's and you can work at the perfume counter, because, you already have your white coat, because medicine just isn't for you. And then for the guys, he would tell them the same thing, but that they could cover up their name badge and go to the meat market at the grocery store, because medicine wasn't for them. And so you can imagine that's offensive, but like literally this guy did this for 50 years. His name is on textbooks that I have in my bookcase right now. And, no one said anything to him about that. And so it's important that we recognize that these behaviors are inappropriate, and really try to move towards something else, move towards something that is more cohesive and more contributory to the learning process. And in my opinion, that is saying, no, that is the incorrect answer. Let me tell you why it's incorrect. And why don't you do a little bit more research on that and come talk to us about it tomorrow or next week?
Thanks. Appreciate it.
I actually have a question. I know you touched on it a little bit in your presentation, but I feel like this is something that is particularly timely. But I was hoping if you could clarify a little bit more on like the role of professionalism and then the use of like one's social media accounts. Like, let's say, for example, there's like a professor or a physician who has a Twitter account, and they use their Twitter account to kind of tweet things that are a little bit contradictory to what the current science says about, like, for example, the COVID pandemic.
Mm-hmm.
But then I feel like they could also argue like, oh, the First Amendment kind of trumps, professional conduct, no pun intended. But what can you like clarify a little bit more about that?
Right. So that's tough. When we talk about medical professionalism, we do have a duty to make sure that we are sharing scientifically appropriate information. If other people are following this individual on Twitter and they know that that person is a physician, then there are times when I share some information on social media and people take it as fact just because of the fact that I shared it and they know that I'm a physician. And so we have a social responsibility, a moral responsibility to really share pertinent information, because we understand that the things that we say and the things that we do can influence behavior. And so I would argue that that is inappropriate for that individual to be doing those things. But when we talk about how we go about reporting that on, from a social media standpoint, then that person could argue, First Amendment freedom of speech. But I also believe that that person's employer would also have a social responsibility to say, look, you can't share that information. That's incorrect. Like, that is inappropriate. And there have been people really since the pandemic started that have shared information that was incorrect. And I've contacted some of them personally and say, look, that's not right. You can't do that. Or I comment on the tweet saying, this is not right. This is not what we should be doing. I'll tell you guys, I know the breakout session is going to end. Maybe we should talk about it offline, but I'm happy to share if someone else wants to talk more about those things and about social media. Any other questions? I do have, let me just share my contact information with you guys, if I can. Otherwise, I'll drop it in the chat when we get back to the main screen.
I know I'm late, so there's probably not time to actually address it, but I was just curious. I am someone who has piercings, and you can't really see it, but I have a nose piercing and some earrings and things like that. So I was just curious. I kind of wanted to talk a little bit more about sort of the appearance aspect of things, because I feel like that also can feed in a lot of times to sort of discrimination and also honesty, because I was a Peace Corps volunteer for 2 years, and they also asked me to take out my earrings and cut my hair. And I chose to not fully do that because it felt like I was misrepresenting myself and sort of the things that I felt like were important. And I know that that's kind of maybe another issue, but because it's something that I've dealt with in the past, I was just curious. But since I know we have to leave, we can talk about it another time.
Yeah, send me an email, Connor. We'll chat about it. I'll tell you my thoughts. And then let's see. Can you guys see my screen now? Did I do it right or no? I don't think I did.
No, we can't see your screen.
Okay. They're going to kick us out of here before I get it together. Y'all see it now though, right?
Yes.
Okay. So here's my contact info. Again, you guys reach out to me. You can follow me on social media. I'll also drop it in the chat.